Welcome to this edition of Peak Life. Today we are talking about the Chesapeake Medical Reserve Corps. Joining me is Thomas Johnson, Coordinator for the Reserve Corps and Deputy Emergency Planner for the Health Department, and volunteer Richard Perry. Welcome you both to the show.
Good morning.
Thank you for having me.
So, what is the Chesapeake Medical Reserve Corps?
The Chesapeake Medical Reserve Corps is the volunteer arm for the Department of Health for not only for the state of Virginia, but also for neighboring states and the entire United States.
Okay.
We are comprised of both medical and non-medical volunteers who are trained to be able to assist in the event of a public health emergency.
Okay. And Richard, you are a non-medical
That's
volunteer
correct.
who was recently recognized for your work. Can you tell us about that?
In the middle of March, Tom asked me to write up a short synopsis of what volunteer work I do, and I gave it to him, and he and I had assumed it was for a state level recognition, which was fine. I do the work because I like it, not because it's recognition's in it for anybody. Found out at the webinar last month that it was not a state but a national recognition I was given, one of two that received award for preparedness and resilience. The other recipient is also from the state of Virginia.
Well, congratulations. That's a big
Thank you.
honor. Absolutely.
I'd also like to point out that out of the two recipients, I mean, nationally we have over 200,000 volunteers with the Medical Reserve Corps. So for that Preparedness and Resilience Award that Richard was chosen for, he was two of over 200,000 volunteers. So we're immensely proud of Richard and his contributions to our Medical Reserve Corps.
That is quite an honor. So can you tell us a little bit about what your volunteerism has encompassed?
It encompasses everything but actually handling medication or syringes at the clinics. That's controlled by the state. But welcoming people, checking paperwork, cleanliness, cleaning the clipboards and the pens, cleaning the chairs after people have been observed after the shots, checkout paperwork. Anything that needs to be done, Tom asked me to do, and I'll do it.
And, that's
It's just
and
that
those
simple.
are very important things, absolutely. So who can volunteer for the Corps?
Anyone can volunteer with the Chesapeake Medical Reserve Corps, practically anyone who's over the age of 18. There is a background investigation that's required, and there are some trainings that are required as well, based on the volunteer's role and what type of capacity they would be serving. So I know Richard was discussing some of our general support roles with the Medical Reserve Corps. So in addition to what Richard was explaining as well, we also have volunteers who perform staging in our clinics. As he mentioned, the paperwork verification, registrations for our patients, line flow control, post-vaccine monitoring is also a component of that as well. Obviously, we have our medical piece where volunteers assist with administering the vaccine. And so in order to be able to volunteer, and obviously in a medical role, these volunteers, they do have to be a credential licensed to be able to administer the vaccine. And there's trainings that are required for that, obviously, for each vaccine. And additionally, we have volunteers that assist with the post-vaccine monitoring as well with our EMS. Those are some additional roles. So in recent years, we've also had volunteers who've assisted with, for example, in our response to Hurricane Florence, we deployed nurses down to New Bern, North Carolina, and we had RNs there for roughly 2 weeks. Following that as well, with the mass casualty incident that occurred in Virginia Beach at the Municipal Center, we also deployed clergy and counselors out to the family resource centers there to be able to support families for the weeks following that event as well. And obviously in our COVID response, our Medical Reserve Corps has been an integral part of our response and been there each step of the way. I mean, from our testing in the beginning to contact tracing, case investigations, And those were done by our general support volunteers who were trained on how to do contact tracing, case investigations, and obviously up to now with our vaccination clinics, which Richard was just describing. But again, to bring it back, anyone can volunteer who's over the age of 18, who has a willingness to assist in a public health response, and who completes the trainings, and we'd certainly love to have.
So if you volunteer for Chesapeake, you may be used regionally, it sounds like.
Absolutely.
Yes. Okay.
Absolutely.
There's an opportunity through the state MRC to take additional classes. Of course, I've taken the course in logistics coordination, which is the setup and operation of a vaccination site or a testing site of any type of operation, security training, how to set up a security system in a facility to maintain control. There are lots of classes to take that are beyond the basics.
And I know, like, if you go to a vaccination center, which I have at Sears, and it was quite an operation.
It is.
And I saw a lot of people doing a lot of different jobs, but it really ran smoothly, I will say.
I'm glad to hear that.
So those volunteers are the ones who basically make it happen, it sounds like.
Absolutely.
A big part of it.
Absolutely. Yes. Over 90% of our operation, if I had to estimate, are done by our Medical Reserve Corps. Any of our city who's come through any of our vaccine clinics to be vaccinated may have noticed the burgundy t-shirts, and all of those are Medical Reserve Corps volunteers trained in their roles to be able to respond, and we could not do this without them. So we are very fortunate to have a strong volunteer base here in Chesapeake of over 900 volunteers, and volunteers like Richard have assisted and aided in this response every step of the way, and we're very fortunate.
It sounds like it's rewarding.
Personally, it is. Raised in Boy Scouts, Eagle Scout, almost 60 years ago, but the training includes learning to help your fellow man. So to me, it's a natural step that I volunteer to serve, to make sure other people are safe. I love it. I have fun.
That's great, and that's important as well, definitely. So if someone wanted to learn more about volunteering or to become a volunteer, what do they need to do?
Well, if anyone who's heard this and wants to just come online and register, they can do so at vvhs.vamrc.org. Again, that's vvhs.vamrc.org. Also at vamrc.org, you can learn additional information about the Medical Reserve Corps and register with us.
And you can, when you register, can you, if you wanted to only able to volunteer for a short period of time, or during this time or that time, you can specify that as well, or just if someone calls you. You
also specify community. They ask, where do you live? And are you willing to travel? I'm a widower, so if Tom needs me to go to Maryland for 2 weeks, I board the dog and I'm leaving. It's that simple.
And to your point, absolutely. Volunteers have the choice to decide when, where, or how long they volunteer. So how it typically works is we'll send out an alert for a request on support for a particular initiative or event, and volunteers can go through and self-schedule and self-sign up. So it's their choice about what event and when they'd like to participate. Obviously, in emergency response situations, we hope to have a strong base of volunteers who are willing to respond. But obviously, we know that we have an essential part of our base as well who may not be willing to travel or assist on the front lines in our emergency response situations, however, may be interested in some of our public health initiatives. Obviously, we're not always involved in emergency response, and when we're not, we're involved in various public health initiatives with community partners. For example, Healthy Chesapeake, who's our population health arm. We also support response to food insecurities here in our city, and this includes when students are out of school for a week for spring break or for summer. We realize that many students rely on those school meals for lunches, and we also have volunteers who will go out and assist with providing students the meals that they need. Along with our low-income seniors here in the city, we'll partner with Operation Blessings as well to ensure that those
So this is
meals are
ongoing for
provided.
sure.
There's always something.
So
for sure.
so you can sort of pick and choose what might be of interest to you.
Absolutely.
Exactly.
That's great. Well, thank you both for joining me today. I really appreciate it, and congratulations again on your recognition.
Thank you. I like to say that I get this award standing on the shoulders of giants. Dr. Welsh, her staff, Tom, his organization, all the volunteers that go and work. I represent all of them in the award for Chesapeake, not just me, it's the whole city that deserves this.
Great.
Thanks, Rick.
Sounds like it. Thank you so much again.
Thank you for having us.
Well, that does it for this edition of Peak Life, and we'll see you next time.